I am Katie Brumfield. I'm the manager of career services at the Colorado School of Public Health. And today we get to speak with one of our alums, Dr. Ernie Williamson. Dr. Ernie Williamson, could you please introduce yourself? Tell us when you graduated from the School of Public Health, your concentration, your current job title, and where you're working.
Okay. All right. Well, hello, everyone. Yes, my name is Dr. Ernie Williamson. I graduated from the Colorado School of Public Health. Actually, in the inaugural year was 2010. So
Wow.
fortunate to be a part of the first 30 to graduate from the program.
Oh,
When I
gosh.
graduated, yeah.
That's
So
very
when I graduated,
exciting.
very much so. It was a wonderful day. I'll never forget it. When I graduated with a concentration. Of course, it was school in my MPH, but the
Uh-huh.
concentration was in community and behavioral
Mhm.
health. Now I've heard the name has changed a bit, but that's at least what it was
Yep.
called when I graduated from
Yep. Yep.
from the Colorado School of Public Health. Currently, I operate as a health education coordinator for the St. Louis County Department of Public Health in St. Louis, Missouri.
Hi.
Um, and what was the other question you wanted me to answer?
No, that's it. No,
Okay.
yeah, yeah, yeah. Where you're currently working, job title. Yeah, yeah, yeah.
All right. All right.
No.
Cool.
Okay,
Cool.
so what brought you to public health? What inspired this career path?
Yes. Sorry. Pull up a seat.
Yeah.
Pull up a seat. All right. So, I mean, I literally have to go back to my childhood with this one
Yeah.
because, as you will see, the path ends up being a non-traditional one, but it's one that I'm so glad I took.
Yeah.
It started when I was 5. My closest sister,
Mhm.
who often babysat me, she was a nurse, and she would often allow me to, take her stethoscope, listen to my heartbeat, listen to hers, and it just sparked some, just something hearing that heartbeat at such a young age. It was remarkable to me.
Yeah.
Um, and then as years went down the road, I got a little older, and I was like, and I'm talking 5, 6, 7, 8, or whatever, and I was like, well, you know what? I'm going to be the next great baseball player. By the way, I'm from New York City, so if you hear the New York
Ah.
accent coming in and out, actually, you're gonna hear a lot of things. I'm a linguistic mutt. I've got heritage from Jamaica, Trinidad, and New York, and all over the spot.
Oh, that's awesome.
Mhm.
I bet
So
you're a good cook.
huh?
I bet you're a good cook.
Ooh, well, now that's that's an interesting say. That took time. That took time. Um, and so at around that time when I was thinking
Yeah.
I'd be the next great New York Yankee because that's my
Well, of
team. I love the
course.
Yankees.
Yeah.
My dad quickly let me know, it's like, son, that's not going to happen at all. Rude awakening, but he was right. And so I remember I was it fourth or fifth grade, and I was beside myself. I was like, well, God, what do you want me to do? I mean, in my head, I really had in mind I was going to be the next. I thought I was going to be Derek Jeter, but
Yeah.
no.
Yeah.
And so after praying about it, the very next day, we had a project in class to go through Time magazines and see what we think we would want to do when we grow up.
Mhm.
And I went through it, and there was a page of some doctors doing some procedure. And I remember in my head, my conscience was like, "That's what you'll do." And I'm like, "Oh, be a doctor? Oh, okay."
Yeah.
And to make the really, really long story short, it was interesting that as I got older into middle school and high school, when I would take those assessment tests
Mhm.
or whatever, it always lined with healthcare and being a doctor. And so I just ended up, going on and pursuing that, graduated from high school. And though I struggled with some of the stuff like chemistry and physics, I still had in mind I want to be a physician or whatever. So I went to college, specifically at it used to be called Oakwood College, now it's Oakwood University,
Oh, cool.
and I obtained a degree in pre med slash chemistry. I got a bachelor of arts in chemistry,
Hmm.
and then after that went to grad school briefly for a year at Loma Linda University. So shout out to Loma Linda University also. I was able to earn a graduate certificate in biomedical sciences, and that actually gave me an opportunity to see what med school was actually like.
Yeah, yeah.
And though there were again some struggles, there was still that desire. I said, "Yeah, I still want to pursue this thing." Took a year off, and then applied to med schools. By to about 11, only one gave me a shot, And it
Only need
was
one.
exactly, and so that's one thing I definitely want to encourage
Yeah.
those who are watching. Don't ever, give up. You always want to apply to more schools or whatever, but like it's exactly right. You just need one.
Yep.
And I was blessed to have that school be St. Louis University. And when I got there, what actually happened is I took a post baccalaureate program, and because I did well in that, it allowed me to get in.
Amazing.
Now, I will say that while in med school, I did have struggles because one of the things I struggled with is standardized tests, and
Yeah.
so that ended up being a big hiccup for me. But I thank God that I was able to. Um, he gave me the strength to overcome and go through, and I was able to graduate from St. Louis University School of Medicine in 2005.
Amazing.
And so then I entered, and I was thinking, okay, great, I'm still on the path that I thought of being this cardiothoracic surgeon or whatever.
Yeah.
Then I learned while in med school what it takes to be a cardiothoracic surgeon, and I was like, maybe I'll just go with cardiology. All right, so then I did that. And then while in the internship, I learned what it takes to be a cardiologist. And there was a lot more to it than I realized. It was more than just just doing well in the courses. There were some other
Yeah.
things that are necessary to get their attention, and I was like, I'm not willing to do that.
Yeah.
But at the same time, I also found that, to be brutally honest and transparent,
Yeah.
within the program, I was struggling.
Yeah.
There were aspects of being able to do patient care that I didn't prepare for, and deep inside my heart, I knew I was struggling, but of course, you don't want to come off that way. You want to be, I'm good,
Yeah.
but the folks around me saw it, especially the administrators. And
Yeah.
what I initially thought was a curse ended up being a blessing. They took me and they brought me to say, they said, listen, Dr. Williamson, we think you're a good doctor, but we don't necessarily think internal medicine is a fit. And then they asked the magic question. They said, have you ever heard of preventive medicine?
Mm-hmm.
And I was like, no, what is it? And so then they told me about its connection
Yeah.
with public health. And I was like, public health? And then they explained a little bit more. And I was like, okay. And so again, it initially had heard that I wouldn't necessarily continue in the internal medicine program. But first of all, again, they gave me a shot. They allowed me to graduate. They allowed me to develop skills. So, again, shout out to St. Louis University School of Medicine. Grateful for giving me a chance and also letting me know about this new field that I'd never heard of before. Once I finished my internship, they let me know, they found me with letters of recommendation and things like that. And so I applied to numerous schools, and that's when I learned about the University of Colorado Preventive Medicine program, and applied for it. Had the interview process went very well, and it was there that I also learned about the public health connection and how it works in correlation with the program. And so I'm waiting, pins and needles. Am I going to get in? I'm going to get in. And I'll never forget it. It was in early April of 2008. I got an email from it was from the graduate school that said, we would like to welcome you to the School of Public Health. And then it hit me. I was like, oh my goodness, I can't get in here unless I get accepted. So then very next email said,
Yeah.
welcome to the Preventive Medicine Residency
That's
Program.
funny.
I lost it. It was just amazing. One of the happiest days of my life.
Ah.
Um,
Well, you
a few
obviously
months,
earned it. I mean, you
yeah,
worked really hard, you should be
yeah.
very proud of yourself. And I think that's, a very common story I hear when medical doctors come into public health and that
Mhm.
they really want to treat a population. They would rather treat a population than one-on-one. And I
And
think
I
that's
would like to, yeah,
amazing.
and I'm glad you said that because I would like to share even more on that. So
Yeah.
once I got to Colorado and those first few classes, then it really dawned on me exactly what you said. That so in my mind, healthcare was only doctors,
Yeah.
nurses, PTs, OTs,
Mhm.
CNAs or whatever. And then I get to the Colorado School of Public Health, and then I learned that, well, actually, healthcare is your pastor, it's your politician, it's your teacher, it's your We learned this during COVID-19. It's your custodians,
Yep.
it's your firemen, firewomen, it is your police, your police officers,
Yeah.
it is your politicians. Like I said, it is so much broader
Hmm.
than
Yeah.
just looking at it through the prism or the sphere of just hospitals and clinics. No, no, no. It's community centers, it's your churches, it's your city halls. I mean, it's all playing a role. And so, as I went through the residency program and the public health program, it dawned on me. I was like, okay, so being able to look at healthcare through a population view is even more, I found it even more fulfilling because
Yeah.
it's like, okay, so I can actually do something before people get sick. I could actually go on the streets and actually provide some education, some resources. I could actually, speak in front of leaders, political leaders, and
Yeah.
try to, bring about through statistics and facts, highlighting, potential policy. What? I could do that. And so it literally changed everything
Oh,
in regards to just being in this room. And that's how I got from, from the 5-year-old in New York to,
yeah.
Colorado, Aurora, Colorado.
I
And
have
actually, shout out to
goosebumps.
overseas. Yeah. Yeah.
You were just meant for this.
Hmm.
Meant for this.
I didn't realize it, but and I know we're going to talk more on this,
Yeah,
but
yeah,
yeah,
yeah.
but that's exactly how it's worked out. It has.
Well, thank you for sharing that because I really appreciate like just saying I struggled because I think, we have to normalize that school can be very difficult and it's
Yes,
okay to pivot. It's okay to change your career goals too, you
absolutely.
know?
No doubt.
Because now you're doing amazing work and you love it and it does work out. So let's talk about your current job. Could you
Yes.
tell us, I know there's not like a typical day exactly,
Mhm.
but like what are some of the things you work on day to day or like big picture stuff? How do you describe your work?
Yeah, so as a health education coordinator, at this point in my career, what I am doing is actually operating as a certified lifestyle coach for the diabetes prevention program.
Oh, nice. Yeah.
And so at this moment, I am overseeing 3 cohorts, two at 2 different community centers, and actually started one at our location at the North Central Community Health Center. Uh, my supervisor and I, and shout out to my supervisor, Emerald Gates, who I absolutely love working for. She's fantastic.
Oh,
We actually graduated a cohort from one of the local churches, which I actually call home, I should say, the Northside Seventh-day Adventist Church.
oh.
We graduated 9 folks, and they actually, check this out. They actually combined lost 90 pounds in the year program. That's right, lost
And
90 pounds. It's amazing.
wow. And probably
And so
improved their health outcomes.
they did, absolutely. And so, yeah, as a part of the diabetes prevention program, it's a CDC run program
Yep.
that endeavors to catch folks who have been told that they're pre-diabetics. So, sugar's getting high, but they're not
Mhm.
necessarily at a level where they're type 2 diabetics.
Yeah.
And through encouraging folks to do lifestyle changes, or as we say in the program, small steps, big changes, in what they eat, what they drink, keeping the importance of keeping track of those things,
Yeah.
increasing physical activity, managing stress, even learning how to survive, not survive, learning how to enjoy food during the holiday season without feeling like you got to be on an island. All those
Yep.
kind of things are
Yeah.
brought
Yeah.
up. And so at this moment, like I said, I'm overseeing 3. We're
Nice.
actually looking to connect with one of the local clinics, Archwell Health. And so, yeah, so what I do is like I said, I operate as a certified lifestyle coach,
Yeah.
and promote that. And also, in addition to that, I'm also in a place where I am looking to make inroads with other nonprofits or other individuals who have shared passions and drives to be able to see if either they're interested or know folks who are interested, or if they're a nonprofit would be interested in being a public health hub to host a program and things of that nature. And we're always looking to promote uh, health education even outside of the diabetes realm. Actually, this year we're looking to do more uh, uh, education as it relates to other chronic diseases like high blood pressure,
Mhm.
um, kidney disease and things like that. So that's kind of sums up what I do and what we're all about.
That's awesome. I've actually done one of those diabetes prevention programs. And,
Oh yeah.
when you're pre-diabetic, it's kind of like very hard to understand, like all of this and like how your
Hmm.
body is functioning and
Hmm.
how to prevent diabetes and all of
Hmm.
this. And your insurance doesn't cover, that
Mm,
support until you have it. And so those programs are amazing. They're so good. They're so good. The work you're doing is great.
thank
I
you.
am a big fan. Big fan.
Thank you. Thank you.
Um, could you tell us like what other organizations or professionals do you collaborate with?
Whoo, okay.
Yeah,
Yeah, be a lot of shout outs. So like I said, I've made collaborations with local churches.
I love
I've
that.
collaborated with
Yeah.
organizations like we have a organization that I love called a Red Circle, which actually endeavors to incorporate urban farming, and trying to tackle employment and other things like that. Fit and Food Connection is another one that we work closely with that endeavors to highlight empowering people to increase physical activity, also tackling food insecurity in food desert areas. Operation Food Search is another one that we work with in
Wow.
regards to learning about healthy ways to cook and doing it at a low price. Wow, there's so many. Archwell Health, Oak Street Health. Basically, we look to connect with other nonprofits in the area who endeavor to connect with populations that are underserved or underrepresented.
Yeah.
And and so the organizations that I'm highlighting here in the St. Louis metro area are just a small example of the organizations that we work with. And of course,
Yeah.
obviously, within the St. Louis County Health Department, we also endeavor to work together to be able to collaborate on or work together on projects or initiatives that are being highlighted within the organization.
That's awesome. That's really cool. Um, I mean, I'm sure community engagement is obviously a big part of your job, but how
Mhm.
does policy and data come into your work?
So yeah, that's a great question. So even before I became a health education coordinator,
Yeah.
I learned from my supervisor that the program. Well, first of all, it was under a grant initially,
Mm.
and as a part of that grant, it required information in regards to where's the area of need greatest in the St. Louis
Yeah.
metro and county areas, and it took data. I mean, we took data from the CDC. There was a website called Think Health St. Louis that also provided quite a bit of data to
Cool.
help us understand and realize that there is a section just north of downtown and also just a little south of downtown, but especially north, and actually ended up being called the Promise Zone, where individuals who live in that area are at a much higher risk of hospitalization due to chronic disease
Mhm.
and chronic disease complications
Yeah.
versus other areas. And we also learned that uh, in those areas, most of them are in areas where there's mostly people of color.
Yeah. Yeah.
And so that having that data
Yeah.
was actually able to help us pinpoint the greatest area of need in the St. Louis City and county areas. And of course, and with that, then we can say, okay, so this is the area of greatest need. What do we have? What can we provide? What kind of resources can we provide for these people who
Yeah.
live in these areas? And so that's where utilizing especially the data was very important.
Yeah.
So for those of you who are interested in biostatistics or epidemiology, uh, professionals like me are very grateful for your
Yeah. Yeah.
expertise because that's where those numbers, where you think it's just numbers. I mean, it matters because there's, now we can have an asset map set up where it's like, okay, this area needs the greatest help. Let's see what we can do to target this area and provide resources to help them, become better and healthier.
Yeah, I love how you like when you were talking, I kept thinking like it's like the numbers told the story,
Hmm.
and that's
Yeah,
how you made the decisions. And yeah, it's data is important. Very
very.
important. What would you say are some of your defining moments so far in your career?
Oh gosh, you know how to put a smile on my face, Catherine. Bless you, bless you. So I'll start from when I got hired. I was gonna maybe even no. You know what? No, it actually. I'll say it started. Ooh, defining moments. I'll go back to when I was in school.
Yeah.
Honestly, when I presented my first presentation to the oh boy, it was in Colorado Springs, at the county department in Colorado Springs, and highlighted, the importance of obesity, even though it's not necessarily a problem there, but at least having a framework where uh, a community can look at benchmarks and say, okay, so this is the things that are going to lower obesity in an area, and here's where we are or whatever. To be able to present that was awesome. That was a defining moment for me.
Yeah.
And then as a hired professional, let me look at my notes here. Yeah, so believe it or not, my another big moment for me once I got hired was creating my first promotional public health flyer. That's
Yeah.
not that part of my creativity is not one that I've never really tapped into. But my supervisor again, Emerald Gates, she challenged me. She was like,
Yeah.
"Why don't you, because I saw an example of one. She's like, well, why don't you go ahead and try one, And I did, and it was satisfactory. It was satisfactorial enough that um, down the line, of course, there were some tweaks here and there, but a number of them that I've done have been able to be used, publicly for, community members to see and to recognize that something's happening. And then beyond that, it was coordinating and organizing my first health fair. That was huge.
That is
Um,
huge.
yeah, and I did it within 2 months of being hired. Actually 2 or 3 months of being hired, I was able to do that
Oh my gosh.
with help from others. But yeah, I was the one who was making the calls and connections and talking and arrangement, the logistics and all that kind of stuff. That was a defining moment for me because in doing so, it helped me realize that I had skills. And I know we'll talk about skills in a second, but there were skills that I didn't even realize that I had.
Yeah, yeah, yeah.
That I realized was being operated and being executed as I'm doing this. And so I was like, okay, all right. So I've got more, to offer than I realized. So
Yes.
that was absolutely huge. Let me see if there's another one that I'm forgetting. Da,
It's
da, da, da.
amazing.
But yeah, I'll just stick to those two because I think with further questions it may
Yeah.
highlight some other things as well.
I just keep thinking about all the people you have helped that you probably don't realize you've helped.
Hmm, hmm,
Like
hmm,
whether it's been through the diabetes prevention program, like think of all the medications people have been able to get off of, or,
hmm,
bringing access to care at a fair.
hmm,
I
hmm.
mean, you
Yeah,
probably don't know because I
yeah.
mean, sometimes it's hard to, get that information, but you could have saved someone's life at that fair, or multiple people's.
Hmm. Yeah, yeah,
So,
it's definitely possible, and
yeah.
it's just great to be out there and to be able to provide that because yeah, when people get it, they really do appreciate it.
Yeah, yeah, yeah. It's just really cool. Okay, let's just generally I'm curious, what are some trends you're seeing or innovations you're seeing in your world, like things that can help in the future?
I am so yeah, there are two main things.
Yeah.
I am so excited about the rise of community health workers and their
Yeah.
influence. I am so excited about that. I'm also, in addition to all that I've done, I've also completed CHW programs that were offered in the area. So glad to be a part of that mighty army.
Yeah.
Um, and just seeing how CHWs are playing such a pivotal role in being a bridge between hospital, being discharged and, being cared for at home or at a clinic or whatever, or in jails and
Yeah.
in so many other areas where CSWs as community health workers are playing such a pivotal role. I absolutely love what's happening. I get a chance to operate in that way at a local food pantry,
Oh,
being able to
cool.
provide resources for those who are attending. And I've been able to make some significant connections. And that's basically what's being a community health worker is all about. So I am excited about the rise of the recognized importance of community health workers. That's a big one. The other one that I want to highlight is um, mental health awareness, and its focus being enhanced over the years.
Yes.
I will never forget when tennis player Naomi Osaka
Hmm.
highlighted, was willing to be vulnerable and share with the world what she's going through, as well as Simone Biles.
Yes. Yeah.
Um, and by the way, shout out to the younger generation, to the Gen Zs and millennials. I salute you all,
I agree.
because you all have shown us and taught us older folk, that it's, when it comes to mental health, it's not about just being tough, and
Yeah.
it's not about just tying up your bootstraps. No, listen, mental health is a serious issue and it's a serious concern, and it often requires the reality that self-care is necessary. and
Absolutely.
and so, like I said, with those athletes, bringing it to the forefront. I mean, we just saw what Simone Biles did last year. She tore up the. I mean, she just destroyed the field. And why? One of the
Exactly.
reasons why is that she was willing to say, "Look at it. I don't care what y'all say. I need to, give myself space for self care,
Hmm.
and then I can do whatever." And like I said, the world saw what she did last year. And so, I mean, if world class athletes understand that self care is important, all of us could take a lesson from that. And so,
Absolutely.
I'm so grateful that, especially the younger generation, is just opening up and saying, "Listen, I don't care what you other folks are saying, but mental health matters,
Yeah.
and it's to be taken seriously." So, those are the
Absolutely.
two that really I'm excited about as far as trends.
Yeah, 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 yeah. No, those are good ones. I'm glad you brought that up because I think I tend to kind of forget about it because it has become pretty normal to talk about, and I'm a trained mental health counselor, so I talk
Mhm.
about it like it's nothing, but then I forget that it's, it is a bigger discussion we need to keep having and
Yeah.
continue it.
Yeah.
Yeah, no,
And
thank
if
you.
you don't mind me saying, Catherine, in regards to the
Yeah,
mental health awareness,
yeah.
why I definitely want to celebrate that greater
Mhm.
awareness, because there's still numerous communities where there's still that stigma.
Yeah,
Unfortunately, I mean, it's getting better slowly but surely, but there's still way too many communities where there's that negative
yeah,
stigma about it. And truth be told, to be transparent, so I was one of them. I
yeah,
was.
sure, sure, yeah.
I used to be one of those who used to look down on folks who were suffering with depression and anxiety. And I used to be like, well, come on, just tighten up your life, and just being really ignorant and dumb about it.
Yeah,
But of course, well, I'll show you how life works. In 2018, I was diagnosed with moderate attention deficit hyperactivity disorder.
yeah,
And so now that I am in the group of individuals who've been diagnosed with
yeah,
mental health condition, now, now it's a shame that it took that to
yeah,
to be humbled. But truth be told, years before, people had seen it, and I it was pride. I was like, I don't want to hear it, blah
yeah,
blah 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 blah. But no, I mean, I have moderate ADHD,
yeah,
and so now it's given me a whole new perspective on what it means to live day by day with, a mental health
yeah,
condition, and what it means to now, I fully understand what it means to be empathetic and sympathetic to those who are going through, because it's
yeah.
not as simple as just saying, oh, well, just change this or change that. It's not that simple.
No, and it's like nice once you can identify it and there are resources and tools and things you can learn from other people and
Uh,
have this like, okay, this is it. It's okay. It's
yeah,
just part of who we are, you know?
yeah,
Yeah.
absolutely.
Yeah,
Yeah.
I agree. I think mental health is probably the most important thing, because it's really hard to do anything else if we don't have.
Right. Hmm. You bet. You bet.
Yep, 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 yep. Okay, so I'd like to jump into some general career advice questions. And for anyone watching, if they are interested in pursuing a career path like you, or maybe they're in med school and not sure that they want to go the internal medicine route or whatever, but from your experiences, uh,
Hmm.
what are the skills that are most important to your success in
Okay, I
your.
will highlight two of them. One of them, and it might be the most important, is your communication skills. And communication skills is, I mean, obviously it's not, maybe it's not obvious. It's more than just what you say.
Yeah. Hmm.
Actually, we know through research that and just through science that the greatest amount of communication that we exhibit or display has nothing to do. It's a very small percentage. That's what we say. It's our facial expressions. It's our body language. It's are we actually are we actually listening, or are we or do we allow biases and prejudices to block when people are talking to us? And honestly, it's something I'm still learning, but that is something that I've been able to get better at, is being able to listen to my participants, listen to my coworkers, listen to other community members, taking heed to those who have more experience than me. And it's helped me to better be able to sympathize and in certain situations empathize with those who are around me.
Yeah.
And so within that communication has been uh, developing uh, a, a cultural humility.
Yeah. Yeah. Yeah.
We as Americans, we can get really caught up in ourselves
Hmm.
when it comes to interacting with other people who may not look like us or believe the way we believe, and think that just because they're Americans that they should somehow fit into this box. When
Hmm.
actually the beauty of America is that we are diverse,
Hmm.
that we do have different perspectives, that we do have different ideas about things, and how they operate. And so being able to understand that and that as a public health worker, you are working with the public,
Hmm.
which means you're going to, interact with people who don't believe the way you do, who don't look the way you do, who don't operate the way you do, and yet and still they need help. Um,
Hmm.
so being able to have develop that spirit of cultural humility has been very helpful to me. The other thing I want to highlight is um, networking.
Ah.
I when I was talking about that coordinating and organizing my first health fair, that's when I realized
Okay.
that I love networking. I love being able to communicate with folks, and then I hear or I detect a similar interest or drive, and I say, well, we're doing this. How about this? Have you considered that? Or they ask me, have I considered this? And then it builds, and so yeah, being able to network has been just a gold mine for me, and just being able to
Yeah.
connect with so many or people in various nonprofits and other professionals has been just been amazing for me. So yeah, those three things I would say are the things that have helped me, or the skills that have helped me to be successful, and I think will continue to help me to be
Mhm.
successful as time goes on.
Yeah, 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 yeah. I can tell you're really good at building relationships and making those connections and creating opportunities for people to get the resources they need.
Yeah, it's a blessing. It really is. I mean, if I detect something I got you. You know what I'm saying?
Yeah.
Let's keep talking. Let's keep talking.
Yeah.
You know.
You're a good person to know. They're lucky to have you.
Floyd, thank you so much. You're very kind.
What are any specific tools or certifications or programs or anything that you would recommend people to learn or add to their skills bucket?
So yeah, that one I thought about,
Yeah.
and I would say, um, look, if you know anyone who is a public health professional, ask, talk to them, ask questions, see if you can, depending on what they do, be able to shadow them,
Yeah.
and see what they do, and yeah, and just find out, kind of like how you asked me, what brought me and
Yeah.
what was it like, for folks like me who gone a non-traditional path, you could inspire someone. And for someone, it may be straight down the line, from college, public health, going right into it. That's fine too.
Yeah. Yeah.
I would say, yeah, so that's what I would say in regards to that. And
Have
let's see if there's
you have
yeah,
you heard of the CHES certification, the Certified Health Educator Specialist?
I have, yeah, and I have. There are a number of folks within our
Yeah.
who have that certification. Yes.
Yeah, yeah. That's one that is pretty popular that I hear about a lot.
Okay.
But
Yep, that would definitely, yeah, that would definitely be helpful, to even as you're going through that certification to actually figure out if that is something that you would be interested in
yeah,
continuing to pursue.
yeah, yeah, definitely. Um, okay, let's see. How do you stay up to date with new developments, technologies, or policies in public health? Like what do you have like I don't know, like associations or journal articles or podcasts or websites, anything like that that you frequent to help you stay up to date with what's going on?
So I'm actually looking to finally actually join the American Public Health Association.
Nice,
Um,
nice.
and then outside of that, our public health department have quarterly meetings where we learn about trends in the area, sometimes around the world. And then there's also some other trainings. Case in point, last year I had an opportunity to learn more about the St. Louis area and how policies from the past have affected the way communities operate even now and the challenges that come with that.
Wow.
And also, I had some training last year to actually learn how to communicate.
Yeah, no, I think those are the best
You see what I'm
trainings.
saying? Yeah, and what I what I was reminded of, and I keep in mind, is that even as I'm communicating with people of various age groups and generations, that certain folks would prefer a phone call,
Hmm.
and certain folks would be like, "Text me, please."
Yeah.
You know, and only text. I'm trying to do this 1-800 whatever. You know,
Yeah, yeah, yeah.
so and that each group of people, each generation, they view the world differently,
Yeah,
and so in order to interact with the public, we must be willing to and must actually learn what that is so that we can better communicate with each successive generation, cultures, the numerous cultures that exist. And so
mhm.
yeah, to be able to have those trainings that those are really good. I'm actually due to have a refresher on how to utilize the Habit New app, that I utilize through the
Okay.
diabetes prevention program.
Yeah,
So I'm
yeah.
going through that actually next Thursday. Because it's so interesting. Truly, education never doesn't end once you get your MPH, your MD, or
No.
whatever degree you get. Um, Education truly is it's a journey,
Hmm.
uh, and so I'm really fortunate to be able to be a part of that. And I'll tell you another resource
Yeah.
that's helpful, and it actually played a role in this interview is LinkedIn.
Oh, yeah. Yep.
I so for those of you who are watching, I found out about this in this program or this podcast, whatever you want to call it,
Yeah.
through LinkedIn.
Yeah. Yeah.
I
Yeah.
saw the post and I was like, Colorado School of Public Health. I'm an alum. I want to share
Yeah.
and that's how I was able to reach out. So yeah,
Thank
LinkedIn is
you.
also a wonderful place where you can learn things and make connections with organizations, and from there find out what they offer in regards to training programs or policy and things of that nature. So yeah, don't sleep on LinkedIn.
No, exactly. I love
Not.
LinkedIn. I mean, I'm on LinkedIn every day, of course, but I
Me
love
too.
LinkedIn. I agree with you. I think LinkedIn's very, very helpful. And a lot of organizations will post, whatever's going on in the moment. So it is a great way to stay up to date. I think so as well. All right, let's see. I think our last question is what advice would you give to someone just starting out their public health career?
Okay, I would definitely say the first thing I would say is, you hear that old phrase that says, "To thine own self be true." Okay, why do I say that? Is because be honest with yourself and answer some questions. One, are you willing to be in an arena where people need help who do not look like you,
Mhm.
who do not believe the way you do, whose lifestyles may not be ones that you necessarily subscribe to, and be willing to do that with a smile. Um, if at that first question you know that the answer is no, don't even bother.
Yeah.
Okay, don't even. Okay,
Yeah.
here's the other question you have to ask yourself: am I pursuing this career because I want to make money? If that is your goal in entering the public health career, what are you doing? Turn around, about face, look for other fields. There are other fields where you could, if your primary goal is to make money, there are others. Public health is not it. Um, so all that to say, you really must have, if you know that you have a love for people, all kinds of people,
Yeah.
and you know that you are willing to be flexible with people's time in regards to connecting with them. If you know that you enjoy being on the streets, like literally, like connecting with community members, if you know that you have a heart for health, but also have a love for typing in the numbers and getting calculations. If you like the idea of being an agent of change, and when I say that, I mean like being in a place where you could be of assistance to those, and if you love the idea of empowering people and to let them know that they can make positive changes in their life, not just for them, but their families, their communities, their cities. If you answer yes to those questions, we'd be glad to have you join us in the public health arena because we
Yes.
need you.
Yes.
Um, there is plenty of opportunity across the country
Oh, yeah.
to be able to make a difference. And public health, I mean, as you look at the history of public health in this country, there are so many things that have been done that if not for this field, I mean, I honestly don't know where we would be.
I
um
know. I know.
but yes, so again, just be honest with yourself, be honest about who you are and what you're about. um I'll tell you the truth. Honestly, even for those of you who may not necessarily feel you're a people person, because I'll be honest, so you may think I'm an extrovert, but I am not.
That's
The
okay.
only reason why you see me like in this mode is because I'm passionate about what I do and
Hmm.
I'm comfortable in it, and I've grown, and so you see an extroverted version of myself. But no,
Yeah.
honestly, I'm an introvert.
Yeah.
Um,
Yeah.
but for those of you who feel that you're not necessarily a people person, there's plenty of opportunities in public health for you to connect as well. And
Yep.
so don't let that be a hindrance, because what will drive you to success and in this field is your passion, love of science, love of people,
Mhm.
and just seeing the world through the eyes of a population versus just one person
Yeah.
going in and out of a clinic or a hospital.
Yeah. 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 No, that was really good. I just want to mention that you said you're an introvert that likes to network.
Yeah. How about that?
I know. You don't hear very often.
Yeah.
So I
Yeah.
love that.
It is
Um,
possible. It is
yeah.
possible.
Oh, yeah, definitely. Definitely. Yeah. Well, thank you so much. Thank you for, sharing your career path with us and what you're doing and the amazing work you're doing in public health. I mean, when you were talking, I just kept thinking of all the people's lives you're helping to improve. And I know sometimes in public health, we don't know, the
Yeah.
impact right away, but
Mhm. Mhm.
you're doing amazing work and they're lucky
Thank
to
you for
have
that, then.
you. I'm glad,
Thank you.
I'm glad you came to public health.
And I'm glad to be here. Thank you so much. Thank
All
you.
right.